There are various reasons why men or women may need to consider fertility preservation treatment. It could be that they're about to commence a strong medication for underlying autoimmune disease, or a young person with a new diagnosis of cancer that's going to undergo chemotherapy, or in some cases radiotherapy. Some people need to have the ovary or the testis removed, and that seriously impairs future fertility. But because long-term survival rates have improved so much, we want to do our best to maximise the chances of you having a family in the future. For men, the process is quite simple, and sperm freezing has a long and successful history. The frozen sperm can be used in the future with artificial insemination or with IVF to help their partner to conceive. For women, the decision-making process is based on their individual circumstances. The things that we take into account are obviously what the actual disease is, what type of cancer it is, what the chemotherapy is. There are different types of chemotherapy and they have differing effects on the ovary, whether or not there's going to be radiotherapy involved. And it's also important to look at background ovarian reserve. For a woman who has a partner, embryo freezing is a tried and tested technique with very successful outcomes. For a woman that doesn't have a partner, egg freezing is now available due to the improvements in freezing technology. For a younger person, where neither of those options is possible, we may consider ovarian tissue freezing and transplantation again in the future. And for women who are merely having radiotherapy to the pelvis but no chemotherapy, the ovary can be surgically removed outside of the pelvis to avoid the radiation field. In some situations, the solution might not be immediately apparent, but the process of talking about it and of planning for the future is really important for your recovery.